The Roosh MMG closed system is a pre-lubricated intermittent catheter in a 1,500 milliliter collection bag for bladder drainage and is designed to help reduce the risk of urinary tract infections. Some of the features of the Roosh MMG closed system include a cap to help protect the introducer tip from contamination, an introducer tip that assists the catheter to bypass bacteria and help reduce the risk of urinary tract infections, a pre-lubricated catheter so it's ready to use with extra gel lubricant in the protective cap if needed, a pre-perforated bag that tears easily for emptying. For catheterization, you will need a MMG closed system, antiseptic for cleansing the urethral opening or meatus, and if needed, the freehand cath-aid device from Teleflex. After gathering all the supplies needed, wash your hands thoroughly before performing your catheterization. Having clean hands is one of the best ways to help reduce the risk of infection. Position yourself for catheterization. Using the freehand cath-aid, hook the top of your pants, pulling them down, and then securing the other end of the device under your chair. Use an antiseptic to cleanse the urethral opening or meatus. Remove the protective cap to expose the introducer tip. While holding the split introducer guide in one hand, feed the pre-lubricated catheter tip forward until it is about to come out of the flexible introducer tip. This helps give the introducer sufficient firmness to enter the urethral opening. The catheter should now be loaded into the tip so that the tip is firm. The introducer tip is one of the main features of the MMG closed system for helping to reduce the risk of urinary tract infection. The introducer tip protects the catheter, allowing it to bypass the first 1.5 centimeters inside the urethra where the majority of the bacteria reside. Therefore, it is very important that the introducer tip is inserted into the urethra the full 1.5 centimeters before you start advancing the catheter. If needed, add some extra gel to the introducer tip. The gel can be found inside the protective cap. If right-handed, using your middle, ring, and smallest fingers, hold the penis with your left hand. Insert the soft silicone tip into the urethral opening using your right hand to guide the tip in. Continue to apply the necessary pressure to ensure that the catheter and silicone introducer tip stay in the urethral opening. Using your right hand, begin to advance the catheter into the urethra 1 to 2 inches at a time. After each push, pinch the split introducer guide to hold the catheter in place while you straighten the bag with your right hand. Continue advancing the catheter until the catheter has entered the bladder and urine begins to flow. After the urine stops flowing, gently remove the catheter with the bag attached. Grasp the bag at the corner where it says, "Tear here to empty," and tear the bag gently down towards the middle of the bag. This will allow you to dispose of the contents without any mess. Pour the urine into the toilet. Dispose of in a proper trash receptacle. Finally, wash your hands again. Thank you for choosing Roosh